Some weeks ago, obviously at the onset of this pandemic reaching Europe, and obviously not knowing the information imparted to us by public health, we started on a very robust process of cleaning, teaching prisoners the importance of that cleaning, that it's not something that the prison is trying to impose, but something that it's for their own well-being, giving them as much information that is out there on why we should apply social distancing, why we should apply the cleaning of hands, not touching your face. Or staff themselves have been given new regimes on how to sanitize hands, how to go into wings, making sure that obviously they keep that distance, enforcing certain aspects of 2 prisoners per cell so that they don't group up, and basically trying for them to understand that they're no different to the outside community, that these rules are there to assist them.
And as part of these procedures, have prisoners had to be confined any more than is usual?
The only procedure that can be said that's had a negative effect on their day-to-day is the stoppage of visits. What we have done, obviously, to minimize the impact on them is that we've increased their phone calls to 15 a week of 10 minutes duration. Because obviously, like in the community gyms were closed, we did the same. And what we've done is with all those periods of time, we've maximized their time in the open air. Mental health is a very important issue, and I think that more than ever, even people at home with all their luxuries are starting to realize what it is to be locked up. I think now more than ever they realize when prisons talk about having necessary programs and ensuring the mental health of prisoners, they more than ever will realize how important it is to be able to stimulate the mind, for them to have fresh air and be able to keep as a normal life as possible. It has been a tremendous effort by the staff who have really stepped up. I've been in the role 6 months, and the last thing on my mind when I took the job was what we were going to face, and it would have been impossible without the level of support and the work that they've put in. Incredible, yeah.
Well, talking about staff, do you have a minimum level of staff that you can keep running the prison on in the unfortunate potential scenario that a lot of members of staff fall in at any one time?
We've self-isolated as recommended by Public Health and our Chief Secretary, 1/3 of that, with the admin staff, 1/3 is in self-isolation permanently, and this is rotated in a way that obviously should people start falling ill, I have people at home that can step in. In addition to that, obviously, we have procedures that obviously as the numbers were reduced, we can obviously come down, making certain adjustments to the regime of the prisoners. We have the facility to come down in those numbers should the need arise, but at the moment I think that we are comfortable to provide as normal regime as possible.